Hi, I'm Dr. William Song from Omni Aesthetics. Let's talk about the SurgY lift. This is a non-surgical neck lift procedure that we perform here at Omni Aesthetics. And this is a really nice treatment because it's non-surgical and it takes advantage of 6 advanced treatments to address that loose skin, fat, and that protruding muscle on your neck. And so let's talk about how we do the SurgY lift. First, the SurgY lift was a technique developed by Dr. Jan Trokel in New York City. He is the doctor who invented the Y-lift procedure, which is a part of the SurgY lift. Dr. Trokel is a renowned surgeon known around the world and has had accolades from magazines and TV shows. So I've been very honored to learn this procedure with him and work together with him performing these procedures sometimes. He's worked on celebrities. Here you see Charlie Sheen, and you can see he looks a lot younger after having the procedure. He's got a nice jawline. That protruding platysmal muscle is gone, and these are the type of results that we get for our patients every day. So let's talk about what we are addressing. These muscles that are protruding on her neck here are the platysmal muscles. So if you have a lot of fat, you may not see the muscles because they're hidden under the fat, but the risk of removing the fat without addressing the muscle is that when there's fat covering it, you don't see those muscles. But when you remove the fat, the muscles stick out and actually might make you look older with some loose skin there. So what we want to do is we want to ligate those muscles so that they're not sticking out. And we want to remove the fat. And then we want to tighten the skin. And then we want to address the jawline as well. So here is a side view. And again, you can see the platysmal muscles. This is a muscle. It's not just loose skin. There's a muscle in there. And when you clench your jaw, those muscles will stick out. Sometimes we use Botox or Dysport to soften those muscles, but that is a temporary treatment. So we want to do something that's more long lasting. The loose skin here makes it look jowly. And then see here at the angle of the jaw, there's really no angle visible here. The jawline, the angle of the jaw has eroded over the years and all the skin has come forward. So with the SurgY lift procedure, we can rebuild that jawline, we can tighten that loose skin, we can cut those muscles and tighten all that skin. So that is how we're going to perform the SurgY lift, and let's get into more details about that. So first, let's talk about the platysmoplasty. This is where we cut that muscle that sticks out, and we can do this now using a closed technique, which means we don't have to cut the neck open to cut those muscles. In the past, we used to have to actually remove that muscle because the muscle, if you just cut it, it tends to reattach and come back. But now we have a technique where we can cut those muscles without cutting the skin open. And then we use the Renuvion treatment to and suture suspension to prevent those muscles from sticking back together. So this is a very neat technique. It's closed, which means we don't have to open you up. It's non-surgical and it's fast healing, very minimal downtime. See how we use a little string after placing that thread, we can use that to cut the band, and then we can do further procedures to prevent that band from sticking back together. And then after we cut the band, we can do a liposuction to remove any extra fat, that fat that's under your chin and even in the lower face, so we can really define the jawline, and we perform this using our power-assisted devices. We can use the micro air, which is what we typically like to use. For some of the tougher cases, we can use the Vaser, and for little cases, we can do it manually. So this is how we do our liposuction, and with the power-assisted device, it's really fast. So that's number two. And then the third part is the skin tightening. And we can use a skin tightening device. What we typically like to use is the Renuvion. And sometimes we can use the ThermiTite as well. But the Renuvion is the most advanced skin tightening device that is out there. It uses helium gas and radio frequency energy to tighten the skin. And at the same time, we use that to cauterize that muscle so it doesn't reattach. So this is just showing how we do the Renuvion procedure. The patient is awake. And then we use a suture suspension to attach the skin to the underlying tissue. So if we cut the muscle and do liposuction, the skin is loose and it's gonna come forward, but the Renuvion makes it sticky and it's gonna stick to the muscle underneath, and we ensure that it sticks by using a dissolvable suture to kind of attach the skin back to the muscle, and that gives us a nice tight skin that doesn't flop forward. And we use the dissolvable sutures because once the skin attaches, it won't come forward anymore. We don't need the stitches. So we like to use the dissolvable stitches, which will dissolve away, but it takes about 6 months for those sutures to dissolve. So it'll keep that skin nice and tight and against the underlying muscle and fascia so that you don't have loose skin hanging from your neck. And see how, again, we can do this without opening you up. Do it through little needle holes. And then the Y lift. The Y lift is where we can use dermal fillers to rebuild the jaw and other parts of the face. And this is a really innovative way of doing this that Dr. Trokel invented. And I had the honor of learning from him. And we love this procedure because it's long lasting, it's natural looking, very youthful looking once it's done. And from a safety point, it's reversible. It's using hyaluronic acid fillers, which are reversible just in case you don't like it. And then finally, we use our Silfirm X, which is a radio frequency microneedling device to tighten the skin further. And this is done externally. So this is a great treatment that we can do as a maintenance. So unfortunately, we can't stop you from aging, but we don't have to do like these bigger procedures over and over again. We can do it once, and then we can use a device like the Silfirm X to maintain the skin, build collagen, and tighten the skin from externally by using little tiny needles that deliver radio frequency energy into the skin on the neck. And we can use this for the full face. It's like a shrink wrap to your whole face. Now let's dig a little bit deeper into how we do these procedures. So the platysmal muscle is a sheet of muscle that goes from your jaw to your collarbone. And these muscles are used for making certain facial expressions. And it's a very thin sheet of muscle. And as we get older, strands of these muscles tend to bunch together and separate, causing those prominent bands. And the bands that are in the center tend to be particularly not so great looking because they make you look old. It's a dead giveaway of your age if we're doing other things to your face that we have so many great treatments for the face to make it look so much younger. But when your neck bands are sticking out and the skin is loose on the neck, it kind of gives away your age. So now we can address that. And what we want to do is we want to cut those bands in the front because those are the ones that stick out. See how the muscle sticks out through the skin. So people think this is just loose skin, but there's actually a muscle underneath there. And if we inject Botox or Dysport into those muscles, it softens it and keeps it from not sticking out so much. But you have to keep doing that. And so we want to do a procedure where it's more long lasting. And then we want to also address the loose skin. So this is how we do it. We use a special technique where we can find that muscle, go underneath and in front of it, all under the skin, and then through little needle holes, we can pass that suture, and then we can lasso it and cut the suture using a thread. And this is our Renuvion device. And this is what we use to tighten the skin and also cauterize that muscle so it doesn't reattach. So watch this.
Renuvion allows for the application of heat to tissue in a way that was never before possible. It is used as part of a minimally invasive procedure. The device is inserted under the skin and activated in a retrograde fashion. As the device is drawn through the tissue, plasma stream couples with and delivers energy to the closest tissue or structure. During this coupling, the heat is delivered in two ways. The first is the direct contact with the helium plasma itself, and the second is with the flow of the proprietary RF energy through the plasma and into the tissue. During application, the vast majority of the energy is delivered directly to the fibroseptal network, which maximizes soft tissue contraction. This technology is unique in that it can quickly heat the subdermal tissues to maximum contraction temperatures while minimizing thermal diffusion to the skin surface. Collagen contraction is resulting from the controlled heating, which allows for some immediate tissue contraction, but full long-term effects will not be seen for 6 to 9 months as the body goes through the healing and neocollagenesis stages. Renuvion, reshaping what's possible.
Isn't that neat? The Renuvion is the most advanced skin tightening treatment that we have available, and it's minimally invasive. We tighten the skin, and the results just keep getting better over 6 to 9 months. So you'll see immediate results with the procedure, but the skin tightening will just continue to improve over time. Now let's talk about how we address the jaw with the Y lift. So here you can see a younger skull, and there's a nice angle of the jaw. As we get older, that angle erodes away and all the skin kind of comes forward, and you lose that nice crisp jawline that we had when we were younger. And now we can restore that using a very simple procedure, and we can kind of extend that jawline. We can even treat the cheekbones and create the illusion of a younger jaw and cheek by treating the bone, not just the skin. So when we look at a skull, here is the jawbone, and the jawbone is actually covered by a sheet of tissue called the periosteum. It's a tough tissue that covers and protects the bone. And we can take advantage of this periosteum by using it as a little pocket, by creating a pocket inside there to extend the jaw. And this is what we do. We inject the fillers under the periosteum to do the Y lift. And then when we do that, it creates a little pocket like an implant. And because it's underneath the periosteum, the filler is not going to migrate. It's going to stay there for years because it's got nowhere to go. but we always have the option of dissolving that using an enzyme called hyaluronidase. But this is acting like an injectable implant. So we get the longevity and it doesn't migrate. So you don't have the soft, squishy skin that could occur if it migrates. And it actually feels like bone. See how it looks very natural? And if you touch it, it feels hard like a bone because it's under the periosteum. Very natural, very youthful looking. So this is immediately after the SurgY lift and the Y lift. And here is a patient. This is several months later, and you can see she's got some nice tightening of that skin. We've improved her jawline, got rid of those platysmal bands, and look how much younger she looks. And here are the garments that you have to wear. The downtime, people are concerned about the downtime. The beauty of this procedure is, unlike a surgical neck lift, you don't have a lot of downtime. The thing that people complain about the most is having to wear this compression garment and the collar. This is a hard collar, the same type of collar that you would use if you had a car accident to keep your neck straight. And the reason you have to wear this, and we want you to wear it 24 hours a day for at least a week. And that is to prevent you from putting your chin down, because when you put your chin down, you run the risk of allowing those muscles to reattach. If they come together, they can grow back together. So if you keep your chin up and separate it for at least a week, that'll then you won't have the risk of the muscle reattaching, so that you can have very long-term results with this. After the first week, you don't have to wear that collar all the time, but we do suggest that you wear it as much as you can for another week. So the downtime is really having to wear the collar 1 to 2 weeks. And once the collar comes off, you can really see the results right away, and it just keeps getting better. So let's talk about the risks and complications. As with any procedure, there are risks and complications, but because this is done without putting you under general anesthesia, the risks are much less than you would if you had a surgical procedure. This is a minimally invasive surgical procedure. We do it under local anesthesia, and so you don't have the risks of things like getting blood clots and during surgery, or not waking up from anesthesia, that kind of stuff. But here are some of the things that you should know about. As with any procedure, there's risk of bruising. The bruising is surprisingly minimal with this. Sometimes you can get some bruising. And if you do bruise, the bruise will kind of go down your neck. It'll change colors. It'll turn green, yellow. But usually after about a week, it's pretty much much better. You can have some reactions to the adhesives. Sometimes people get allergic reaction to the tape and garment. You can get bleeding, and sometimes it could bleed, especially if you're on blood thinners. So definitely let us know if you're taking blood thinners. You can get a hematoma, which is bleeding under the skin, where the blood collects under the skin. And if that occurs, then it may require us to evacuate the hematoma with a needle, and sometimes it may even require surgical evacuation. But these are very rare. That's something you should know about. As far as pain, it's not particularly a painful procedure. Afterwards, there is some discomfort. And usually after a week, you're pretty much good. But sometimes you can have pain that's more prolonged. And that's like with any procedure. And you can get infections and burns. And again, these are very rare with this procedure. We give you some antibiotics to prevent infection. The Renuvion is probably one of the safest thermal devices. with some of the lasers, you're more risk to getting burned, but this is a radio frequency energy that we use, and the helium gas cools it almost instantly, so you don't have the risk of burns, but that's also possible. Poor wound healing is possible with any procedure. And as I mentioned before, the muscles can reattach, requiring a repeated procedure. But if we follow all the protocols, keep the garment on, then the risk of reattaching is pretty minimal. Scarring can occur from the entry sites or even underneath, and sometimes scarring can be permanent, but it's rare. Internal sutures that we place, remember that? Sometimes if you have very thin skin, you can see the suture, you can see the outline of the suture through the skin, okay? And if you do see the sutures, we like to just leave it alone because it's going to dissolve and go away. It could take several months though, okay? If it's really bothering you, we can remove it, but the sutures are dissolvable and they will go away. Sometimes the sutures can extrude through the skin. That's more of an issue when we use permanent threads, but even the disposable threads can sometimes extrude through the skin. If that happens, we just remove it. You can have some skin irregularities or buckling, and that is normal. And for the first few weeks, you'll see it. Sometimes it could last longer. And most of the times, it'll just resolve over time. But sometimes you may need a little revision if it doesn't go away. Poor cosmetic outcome, as with any procedure, is a risk, and that might require revision or surgical correction. But usually we don't need to do any kind of revisions with this. Lidocaine toxicity is a concern because we don't use general anesthesia, so you don't have the risk of general anesthesia, but even with local anesthesia, sometimes you can get toxicity. We're using very small amounts of lidocaine compared to when we do like a body liposuction. So the risk is low, but it's something to be aware of, as well as allergic reactions to any medications or fillers. That is a risk with anything. And then, as I mentioned before, if you get poor filler results, if you don't like the way the filler looks, it is reversible, which is really nice with the hyaluronic acid fillers. That's why we like to use that. And when it's placed under the periosteum, it's a very long-lasting result that you can get, and you can always touch it up too. So the Y-lift part of this and the Silfirm can be done separately as a separate procedure, and they're actually optional. Not everybody needs to have this done. When you do all of it, that's where you're going to get the most dramatic results. But some people don't need to do all the procedures. For as far as the pricing, one of our consultants can discuss that with you. You can do the whole thing, or we can recommend which parts of the treatment are most appropriate for you. And also, you may not need this at all, and we would be able to tell after looking at you. So this is Dr. William Song. Thank you so much for watching. And if you have any questions, please do not hesitate to call us.